It's a pretty amazing story on the front page of the Age this morning, talking about warnings that Victoria's public health is significantly underfunded and under-resourced, and was warned about this a while ago. You've read this story. What does this say to you?
Well, I think we spoke about it on Monday on the show, and we've spoken about it before, is that Victoria's health system is not fit for purpose for a modern health system, and it's becoming increasingly clear. Whereas other states have a population-based approach where you have an area where the health service looks after, which encompasses several hospitals and looks after the population and has a public health unit on the ground established there. Victoria doesn't have that, and relatively few of these area health services, whereas Victoria's got over 80 individual hospital networks. They're not even networks, they're individual hospitals, apart from the country, rural and regional Victoria. And so you've got the Alfred standalone almost, the Royal Melbourne and so on, and they don't have a responsibility for the population, and therefore they don't have public health resources. Victoria has relied on the Victorian Health Promotion Foundation, a great organisation for its health promotion, has outsourced other work in public health, and has a centralised public health resource which is not fit for purpose. A modern health system looks after its population, not after its hospitals. Widely recognised, and Victoria largely dodged the health reform process a few years ago, which really tried to get area health services into place, and that's what happened in Queensland, New South Wales, South Australia, Western Australia, and Tasmania, and not in Victoria.
Yeah, of course, a pandemic like this, a major event like this, is always going to expose the weak or fragile structures and institutions. That seems to be the case with Victorian public health, but it's clearly the case with aged care.
It is, yes, and that's probably not, that's not on the Victorian government's watch, that's on the Commonwealth government's watch. I mean, it is extraordinary, and again, as we said on Monday, when you've got this many aged care homes in play in terms of COVID-19, this is not a problem of individual bad players. There is something fundamentally wrong with the way private aged care is structured, and that's on the watch of the Commonwealth government, regardless of which party is in power. And that's what the Aged Care Royal Commission is looking into. You have inadequately trained staff. You have, I'm told, in their training programs, such as they are, that infection control is an option, not a compulsory element. You have, they are financially stretched, many of them, and they're for profit. Profit's not a dirty word, but when you're financially stretched, things get cut. And this is, as you quite rightly say, Ben, when things go wrong, the system gets stressed, and when you've got a stress test, it starts to fall apart. And let me tell you, anybody watching anywhere else in Australia other than Victoria, you've got the same problems. We've had there was a big outbreak in New South Wales. This could happen anywhere in Australia because they've all got the same problems. It's a tinderbox.
Talking about it could happen anywhere in Australia, we're now seeing this situation in Queensland where they've had those few cases there in the southeast, and the Premier there has moved very quickly, separately, to ban all visitors from Greater Sydney now. What do you reckon? Is that an appropriate move?
Well, just put yourself in the position of the Queensland government. First of all, the surveys that the mathematical modelers do looking at the future of the pandemic showed a few weeks ago that Queenslanders were not socially distancing. And in fact, the recipe was there in Queensland that if coronavirus were to land in Queensland, it would take off, because it was one of the worst states for social distancing. People in Queensland have got too relaxed about coronavirus because you've had almost no circulating virus, if in fact none at all. And there, all you got to do is posit coronavirus into the Queensland population, and it could really take off. So you've got these two young women, one extra one. There probably will be more. And in an environment in southeast Queensland, which is relatively highly densely populated, and this could take off. So if you're the Queensland Premier or the Chief Health Officer, Jeanette Young, you'd say, well, I've got this to deal with. Why would I take a risk, no matter how small, of somebody landing at Coolangatta, the Sunshine Coast, or far north Queensland with the virus, and then I've got 2 outbreaks to deal with, or 3 or 4? You can understand where they're coming from. And, Queensland will suffer more from this economically than Sydney will, because it was Sydney-siders going up on holiday.
And one of the things that's made it so difficult to respond to this virus and this pandemic is that really 6 months ago we knew not a lot about it, and so we're learning about what it is, how it works, and we've just got some new information on one of the big ones, which is how long people stay infectious.
Yeah, just one brief thing on that, Ben, before you go on. Not a single textbook of public health will have to be rewritten as a result of COVID-19. It's behaving the way pandemics behave. That's why the public health resourcing was so important in Victoria, and that story is so important in The Age today, is there's nothing new about this pandemic. What is new is about individual things, as you say, is how the virus behaves. And this study was looking at how long you remain infectious, and implying is 14 days adequate for isolation, as no doubt Michael and Lisa are wondering, and your floor manager. So what this in brief showed was looking at a review of many different studies here and bringing them together, is that it's rare, very rare for live, in fact there was no case of live virus being discovered 9 days after symptoms appeared. So if symptoms appear roughly 5 days on average after you've been infected, then that brings you to around about 14 days. So 14 days does look like a pretty safe period for isolation or quarantine.
Okay, thank you very much, Dr. Norman Swan, as always, host of the Coronacast and, of course, the Health Report on RN.